insurance companies. Well, I'll keep my private insurance company because I like what I have. If you have what you have, you're going to keep what you have. Sound familiar? Nancy Pelosi's bill came out Friday. There's only going to be 3 levels of insurance. Premium, basic, premium, or premium plus. That's it. They're going to tell the insurance companies what they can cover and what they can't. I don't think there's much of a choice. So it doesn't matter if it's called Blue Cross Blue Shield or Aetna or Cigna, they're all following the same rules. Because it's controlled by the government through the CER stuff. The public land. If you like what you have, you're going to keep what you have. No, you're not. Not only because they're going to redefine what you have, so it's no longer what you have anymore, it's what they say you should have. But your insurance company, your insurance plan is allowed to stay in, according to the Pelosi bill, because it's grandfathered in. The moment you give it up, that's it, you're done, you're never going to get it back. Because it was grandfathered in, but we're not giving you another one. Right? So essentially what they're telling you is, okay, you're going to get to keep what you have until you give it up, until you change jobs. Right? If you change jobs, you're not going to be able, you got to go through the national exchange. So be wary of this commentary about you keeping what you have, because they're going to keep it temporarily. And by the way, we're going to change what you have into something else. And as soon as you give it up, you're never going to get it again. The other thing that they're going to do is they're going to put more weight on insurance provision on the employer. So, okay, so now I'm an employer. By the way, do you guys know how employer-based healthcare insurance came about? It was an accident, right? World War II, they froze the prices, they froze wages. And so, you know, we needed to hire somebody, we needed to attract somebody to come and work for us, so let's give them healthcare insurance. It wasn't because it was a great way to go, it was simply because it was a great way to attract more employees in a time when wages were frozen. Yet, it became so popular that there it is. 53% of our population is covered under employer-based health insurance. It's going to increase the tax burden on the employer. What's more, they want the employer to pay the employers that can. They want the employers that can to pay for the employers that can't. I don't know. Think of somebody who's still floating. Home Depot. If I'm Home Depot and the government is telling me that they're going to make me pay more to this national exchange so we can fund the employers that can't. And it's going to be based on my payroll. By the way, didn't tell you that part. It's going to be based on my payroll. What do you think I'm going to do? I'm going to cut my payroll. I'm either going to cut my payroll by firing people, or I'm going to cut my payroll by decreasing the wages, the salary. So the pressure is going to be on the employer. It's exactly the opposite pressure that you want to put on the employer to survive. But there are alternatives out here that you can consider that don't hand it over to the government. And don't give them this massive amount of power over you, over your life. HSAs, health savings accounts, it puts the consumer back in control of the price, and it causes the patient to negotiate with their doctor. Do I really need that MRI? Or, yeah, give me that MRI because the insurance company will cover it, right? So healthcare insurance opens so many doors to the government to defend taking further actions on you. Not only just in restricting the care that you receive, not only in putting priorities that are not your same priorities on what kind of care you receive, but also it opens the door on saying, you know what, we're paying for your health care, so you need to comply with all these lifestyle interventions that we say that you should. Resist this to the end because it will totally redefine our country. Thank you.
Next speaker is Wayne Sakamoto, and Wayne is the media chair for the National Association of Health Underwriters. Wayne lives in Naples, so he is a local, and he works with Health Insurance Interactive. He will present a Washington update from the perspective of the insurance underwriter. So let's welcome Mr. Wayne Sakamoto.
The National Association of Health Underwriters. We represent 20,000 members who are insurance agents. They represent insurance companies. They actually represent hospitals, provider groups, It's just an amazing organization to really make sure and maintain this private marketplace. What's amazing is that here we have people all over the world that want to buy health insurance, private health insurance. Why in the heck is this country wanting to run away from one of the best healthcare in the world? But I wanted to let you know about the number of campaigns that we've done with the National Association of Health Underwriters. We've been working on amazing campaigns to really educate America. In fact, NAHU's media and legislative efforts to protect consumers. And yes, we're educating our lawmakers. We're trying to let them know that we have a vibrant health insurance system that has a lot of great resources. So we call it a Healthy Access Plan, trying to be responsible for your individual rights and really the great resources to make a difference in your own wellness. Believe it or not, ABC actually has a camp. They have an office in the White House. On the GOP side, the Senate side, there's been limited bipartisan, of course, cooperation with both the Health and Finance Committees because of the divide on the government-sponsored health care. No bipartisan cooperation in the House. And, of course, the GOP, obviously, they do want to see, you know, more common principles, such as giving states all the Department of Insurances and in the states, and, of course, businesses, more flexibility in regulating and buying insurance. And also they want to talk about new tax deduction credits for individual small businesses and focus on expanding insurance coverage through partnerships. Time frame for reform. Now, you need to pay attention because, so let me mention to you, the goal is to have the bill passed in both houses before the August recess. The recess lasts between August 7th and September 7th. That's a great time to meet with your representative Congress. Please do so, it's important. And then after that, there's going to be a conference following the end of recess. And then grassroots action. Really, I want to say that it's important for all of you to really be involved, meet with your legislators. Feel free to contact us through the National Association of Health Underwriters.
To the end, I hope you guys are all getting something out of this. It is our ultimate goal, is to provide a forum for the people, because we feel that we're getting all this legislation that's being pushed upon us, and nobody's asking us what we want or what we think, and ultimately we're the ones that are going to be under this system. So that we have a physician here who actually went through the system in England, and I don't know if you want to say anything about where we're headed and what happened.
And there was really very little that once it was in and established, it's awful hard to go back. In fact, it's impossible.
This is an administration that wants to change the social contract that we have in this country. The encouraging thing about it is who's invested as much time in the past as they have in the last 6 months in these kind of citizen forums.
We have prepared for you healthcare home meeting kits. Home meetings are a very effective grassroots method. Let's keep it going. We've had some great information provided to us tonight, but we've got to take it out there. We've got to educate the public, and we don't have much time. They're trying to wrap this up by July the 31st.